Brought her some gummies and we ate donuts. And this is what happens to Malia when she's quiet sometimes. She's either getting bit by fire ants or mosquitoes, and she was doing nothing about it, so we had no idea.
You and your nervous system's way of regulating emotions or impulses via a repetitive behavior. When it comes to autism, it gets a lot deeper. And before we get too into detail, it's important to note that autism is a spectrum, and there's no way for one small video.
After watching the video, have you ever seen kids or children behaving like this? So these are some of the common signs of autism. But wait, don't feel bad if your kids or anyone you know might be probably autistic, because they are just like us, except just a few biological and some brain differences. Now, what is autism or autism spectrum disorder? It's a neurological disorder that affects how people communicate, learn, and behave. Most importantly, why is it a spectrum disorder? Have you ever wondered? Because no two individuals diagnosed with autism are alike. People with autism are affected in different ways to a different degree. Some may benefit from social interactions and enjoy talking to people, while others might be personally independent yet socially awkward. So let's take a look at some symptoms and strengths of autistic people. First of all, autistic people are not very sociable. They are very often awkward when meeting new people, and they are not using eye contact. Like you see in this video, they often avoid seeing people directly because it makes them feel uncomfortable. Third, they don't understand social cues, like when people use body language, when they wail, when they say hi, when they have angry face, or when they adjust quite a harsh tone of voice. They don't really understand what kind of message it really conveys. And number four, they are hard to adapt. They can be proven maladaptive when it comes to changing situations, and they really hate unpredictable events and struggle adapting to it. They also avoid high sensory inputs like strong lights, like loud sounds or loud scream. And also the most very common symptom is stimming. So they enjoy stimming, like flapping their hands, like flicking their fingers, whirling their hair, and blah blah blah. So this kind of activity, stimming, also helps regulate emotions, aid memory and concentration, as well as reduce anxiety as well. So if your kids or your child are doing stimming, don't just stop them. Oftentimes they must themselves to fit into a social group and avoid being looked stupid, especially in certain situations and cultures that easily stigmatize certain behaviors like stimming as inappropriate. However, there are some strengths as well as being autistic, like learning and remembering facts, events, and memories. This is called episodic memory. And they also have an ability to solve problems like math, puzzle, simulation, which is called the visual problem solving. And number three, they are likely to follow schedules and routines, and they want to be consistent with their habits. And number four, they like to think from other people's perspective. So this helps them become quite innovative, creative, and empathetic. Now let's talk about the levels of autism. Of course, there are three, and each level means more support is needed. So level 1 is the mildest level, that requires mild or minimal support. So in this level, here are some common symptoms, like they have problems with communication, they cannot interpret social cues and often speak inappropriately at the wrong time, and they cannot speak full sentences, though they should have acquired the ability according to the developmental milestones, which I will be talking more in the next video. So let's say by the age of 5, they are able to walk, to speak, and to create full sentences, to express the ideas in a variety of ways. But autistic people might have delayed speech. They tend to express their ideas in a very narrow sense, and they might not be quite expressive enough to make people understand them. And they might not be good at maintaining relationships or make friends. And also they are not good at organization and planning. And level 2, of course, this requires substantial support. For autistic people who belong to level 2, they often engage in repetitive activities and hate to change. And they speak in simple sentences and can express a variety of language used. Like they use I go to school, I go to bed, I use toilet, blah blah blah, but they cannot go beyond these simple structures, like using complex or compound complex sentences. And they often struggle in nonverbal communication, like using body language to express ideas, eye contact, facial expression, etc. Level 3 is pretty similar to level 1 and level 2, having similar symptoms. However, those symptoms are going to an extreme level. They have a hard time expressing themselves and having communication difficulties, and they hate to change. All of these are going extremely difficult for them. And so in level 3, they really requires so much support from their friends, from their family, and those around them in order to help them progress forward. And let's talk about the myth of autism. Number 1, people with autism don't have emotions or feelings. In fact, they do have. They just struggle to express those emotions. Number 2, people with autism cannot handle change. In fact, it is just difficult to handle change, not just autistic people, but all of us in general. We all are the creatures of habit. We don't want anything to change quickly. We want to stick to our habits, and not just autistic people, but the thing is that autistic people may have a more difficult time adjusting to changing situations, and they are very maladaptive. But there are some coping tools to help them, like they need to prepare, they need to plan ahead, and also they need time for adjustment. And number 3, they are not interested in having friends. Of course, although it's true that they have problems with communication skills, it doesn't mean that they hate friends or they don't like having friends. They do have emotions and they want to make friends with those who show interest in like they do. Although they probably have some problems with maintaining friends, with making new friends, with initiating conversation and stuff, eventually they still have interest in socialization. For my final advice, if you have seen anyone or if any of your family members are probably autistic people, I think you can try to observe them and match them against the benchmark of the autism. You can check out the internet and search for any criteria that you can measure against in order to find out whether that person is autistic people or not. In order to get a realistic and reliable answer, you can get your child or get someone you are concerned about diagnosed by the professionals to get a conclusive answer about whether or not the person is autistic. Because sometimes what you're thinking is not as always true. So yeah, thank you so much.